So Dan, there are a number of adverse events with the IDH inhibitors. We know about hyperbilirubinemia, typically unconjugated from the UGT1A1 inhibition, QT prolongation, which we're all aware of and can manage by looking at other drugs that they're on and monitoring the EKG. But the one thing that you do need to make comment on in this panel is differentiation syndrome.
Sure. Yeah, so, we're finding, upwards of 10% or so patients experience differentiation syndrome. Important thing to recognize is that unlike the familiarity with differentiation syndrome and APL with arsenic, it can occur much later in the disease process, so it's not necessarily something that you'll see in the first couple weeks or even month. Management is important, early recognition. It's a diffuse clinical presentation. Almost anything can be differentiation syndrome. So you have to be very careful about watching for anything that might look like it. And then recognition, initiation of steroids is very important. We try not to discontinue the inhibitors if we're able to, because there are a number of patients who go on to have very good responses,
and it won't do you any good because the half-life is so long.
That's right. Yeah. So by the time you stop it, you got to wait a week. That's a good point. Hydrea to bring the counts down if it's like a proliferative differentiation. So there's definitely ways to management, but I think it comes down to recognition.
And I think for me, the two things I hang my hat on is I go and look at the smear, and if I see differentiation, which may be missed by the lab tech because they don't know what they call these cells. They look very weird, and so they'll still call them blasts. You need to go look. And then the other thing is the therapeutic trial of dexamethasone is also a diagnostic trial. If this differentiation syndrome, my experience is they turn around pretty quickly with that.
Yeah, that's true.
Okay.
You want to make sure and add, so that the differentiated neutrophils, whatever they are actually aberrantly honing to areas of inflammation or infection. Usually there is some underlying infection. Much like with APL, you don't want to forget to throw on the antibiotics as a...
And just to come back to it for a second, gilteritinib has now been associated also, or has been associated with differentiation syndrome.
Less common, and the reason is a FLT3 inhibitor debulks the disease first, kills 3/4 of the disease in the first 2 days, nothing to differentiate. So there's a lot less to differentiate. But yes, you got to watch for it with gilteritinib.